Hello everyone, how are you doing? Your doctor is here again today, Dr. Tinuade. So today I want to talk more on gonorrhea in females. This will be my fourth video on gonorrhea in females. You can check the other things I've talked about on gonorrhea in my previous videos on my Facebook page, STI and Female Health Matters with Dr. Tinuade, on my YouTube, Dr. Tinuade on sexually transmitted infections. That's on my YouTube channel. On TikTok, on Instagram, just type my name, Ajani Tinuade. So I'm going to continue. You can check those other videos. I don't want to talk about things I've talked about before. So another symptom that I'm going to start with today is lower abdominal pain. You can have lower abdominal pain because of gonorrhea, and this is also because of inflammation. In the other video I was trying to explain inflammation, that inflammation, just see it like you're having wound in a place, maybe you sustain a wound on your leg. Sometimes it can be bringing water, it can be painful, it can be irritating. So when people have that inflammation, that irritation can just be stimulating some nerves, and the person can have that pain. In fact, some people can have that pain for life if the infection is not treated. So that's one of the symptoms. Then another thing that people can have is frequent urination. That means that person go to urinate all the time. I've tried to explain the female genital area. You can check my previous video on that. And like I said, in that area, the female genital part, the vulva now, you have two holes. The one that is at the top, we call it urethral orifice. The one that is down, that's the vaginal orifice, and they are close to each other. So during sexual intercourse and things like that, the fluid that is infected, either from the male or the female, can actually get into that urethral orifice, the one that is up. And that urethral orifice leads to the urethra. That's the passageway to the bladder. So when the urine is coming from the bladder, it comes through that passageway to come out of the body. So that place can also be infected as well. And when that place is infected and we have this inflammation irritates the bladder, irritates some nerves. So it gives this feeling like as if the bladder is filled up. But in the real sense of it, the bladder might not be filled up. So the person will be going to the toilet all the time. There are other symptoms in the body that can give this. In fact, UTI, urinary tract infection on its own, that doesn't have anything to do with sexually transmitted infections too, can give that kind of symptoms. And there are other things in the body, other clinical conditions, other health issues in the body that can result into this, but gonorrhea is one of them. Then apart from that, there can be eye infection. So how do people have eye infection? Is because sex can be rigorous during sex, manipulation, here and there, maybe kissing, there might be oral sex, there may not even be. Somebody can just get the fluid either from the male or the female that is infected with the bacteria, Neisseria gonorrhoeae. That somebody can get that fluid into the eyes. And when it gets into the eyes, so the eyes can become red, it can be discharging, it can be white discharge, it can be discharge that is like the eyes is bringing out pus. The eyes can be red, it can be painful, so we can have that too. There are other conditions too that can give that kind of symptoms, but gonorrhea is one of them. Then another one that I'm talking about now is anal infection. That area where we pass out feces, there can be infection in that place. That place is close to the vagina too, so during sex, that fluid too can lead to the anus, and that one is even bad. Anal gonorrhea is bad. Then anal sex can give that too, but even without anal sex, vaginal sex can actually cause gonorrhea infection in the female if one of the partners, maybe one of those people having sex, one of them is infected. So you can have that. The anus can become red, can be bringing out pus, water, there can be wound when the person wants to pass feces, it can be painful. Gonorrhea can cause that. There are other things that can cause that. Gonorrhea is also one of them. Then another thing is if gonorrhea enter into the body, gonorrhea can enter into the body, actually get into the blood, and when it enters into the body to get into the blood, it can go into the joints, so can cause arthritis. Though this thing is rare, but it occurs. Some people have had this before. Arthritis, the joint to be paining them, to be difficult to use the joint, the movement at that area will be reduced. Gonorrhea can get into the heart to cause heart infection, can get into the lungs to cause lung infection. Then a pregnant woman too can transmit gonorrhea into a child. You know, as the baby is coming out through the birth canal, the baby can get infected with gonorrhea, and they can have infections in both eyes or one eye. But what I'm saying is gonorrhea can cause eye infection in children, newborns, and that can be bad because it can even lead to blindness. Then it can cause infection of the lungs, the respiratory area, the lungs. Those areas too can get infected with that bacteria, and the baby can be very sick. Number one, you know, babies, they're fragile, they're just coming. Their immune system is not as developed as ours, so it's easier for them to get infected and come down with complication. The eye infection, we call it ophthalmia neonatal. It can really be very bad because it can lead to blindness. That can make a child to be blind. So that is why, if you have all these symptoms and you know you're having feelings that, oh, maybe, you know, you have more than one sex partner, or you have had sex with people that you think maybe they are infected, or if your lifetime sex partner, what you mean by lifetime sex partner is this: maybe since the time you have been having sex, maybe you started having sex when you clocked 20 and you're 30 now. If you want to count how many people you have slept with, maybe it's like 5 or 6. That's your lifetime sex partners. So how many people have you slept with since you have started having sex? By the time you are having more than 2, you have that likelihood, there's that risk, there's that tendency to be infected with gonorrhea. So if you have any issue, you can contact me on my Gmail, Dr. Tinuade, talking about sexually transmitted infections, 023@gmail.com. Don't worry, your case to be treated. Nobody will know about it. When we talk about medicine, we talk about what we call confidentiality. So don't worry, it's not like everybody will know you have sexually transmitted infection. We know that there's this stigma around sexually transmitted infections, but that is not a problem. So you can contact me on my Gmail, Dr. Tinuade, talking about sexually transmitted infections, 023@gmail.com. Or you can contact me on my business line, 0811774239. I'm going to take that again, 0811774239. Till another time that I'm going to come to talk about this gonorrhea again, but this time around, my next video, that will be my concluding video, and that will be on complications of gonorrhea in females. Bye.